From gowns, scrubs, sheets, and bedspreads, each hospital has medical linens. But when these items get old and need replacing, thousands of pieces of medical linens are usually sent to landfills. The Winnipeg Regional Health Authority and Shared Health have taken a different approach and have sent 64,000 pieces of linen to Africa, where they are greatly needed and will be used in medical settings there. Joining us now to tell us more about this effort are Patrick Sabourin, the WRHA's Director of Regional Healthcare Linen Services, and Lea Cote with Shared Health. Good morning to both of you.
Good morning. Good morning.
Thank you so much for joining us. Now, when we think about medical linens, really, there's so many different you can find in a hospital setting. Describe them. What are they exactly?
Well, usually you have gowns patient wears, terry linen, so hand towels, bath towels, and then some of the bed linens, so flannels, warming spreads, pillowcases, and then we have some of the surgical items as well, such as surgical gowns, wraps, so quite a variety of items. So in total we have over 150 skewed items.
Wow, and they're vital. You need them in the medical setting.
Absolutely.
You can't go without them. And so what led to the place that you were in where you found yourself with so many extra linens all of a sudden?
So part of our transition to a smaller warehouse, we had to look to reduce our footprint significantly. So we were looking at our inventory and we assessed that we had a large amount from the pandemic that we purchased, as well as our legacy inventory that was through the consolidation of Selkirk Laundry Facility. So that was gowns, blankets, bedspreads, and scrubs.
Okay.
And then we had to look at all viable options. So what do we do with these items? And that's the point where I connected with Lea in regards to, is there a way that it doesn't end in the landfill? And we had quite a short timeline around, so we had to work quite quickly.
Okay, and so what idea did you come up with?
Well, after contacting several different organizations, we found our partnership with Hope and Healing International. And so within 2 weeks, we were able to turn around and send all these linens to facilities. First in Toronto, we sent through shipping container there, and then they shipped them on to Cameroon in Africa, to hospitals there.
And how did you know that they needed the help? It's the organization you're talking about? They
Correct.
know who needs what and what's happening out there?
Yes, so they have the partnership, and so they provided that opportunity where we were able to connect with them, and they had those connections where people have already reached out and said what they've needed. So they've taken the need or the materials and matched the need with that. So
we're talking 64,000 pieces. That's a lot. So when they're being shipped, it must have been good for the landfill here. It's not going in the landfill, but also for people in Africa. What sort of response did you get from them?
Right, so we were able to get some feedback, and they were just overwhelmed and very grateful because now they were able to take these materials, reuse them, and help people in need. So it was saving items from the landfill, but also providing that support for those hospitals over there.
Right, so knowing this now, how are you going to move forward with this information?
Well, I think this is a great start to a very strong collaborative partnership where anytime that we see opportunities where I have extra linens, then we could reach out to our local community and then provincially, nationally, and then look at international as well. So it really puts the emphasis on that strong collaborative approach between WRHA and Shared Health and how it's important to look at these opportunities so that 19 tons of linen does not end up in the landfill.
And it's still usable. It was
Correct.
still in pretty good shape. What happens with the ones that are not usable? You have no choice, I guess.
Yeah, so if it's cotton based, we usually rag them out. So, and at that point, they could be sold to companies that use them for painting or whatnot. And then for the ones that are cotton, polyester, yes, unfortunately, we have to throw them in the landfill, which is not the best thing for us as we try to promote to be as green as possible.
Right.
And that's great to have that collaboration with Shared Health